everybody, and welcome back to my channel. If you're new here, my name is Charlotte. I hope you will go subscribe if you aren't already so you don't miss out on any future videos. Today I thought I would do a video on tips for clinical because as a nursing student, this is like a backbone of the nursing curriculum. It has been one of my favorite parts of nursing school so far, and now that I've had a couple clinicals, I want to share my tips with you so you can get the most out of them. So I have a lot of tips actually, so I'm going to try to go through them pretty quickly so I don't take up too much of your time. But if you like this video and you agree with any of the tips below, give it a thumbs up and comment any others that you could think of down below in case I forgot some. Just as a little bit of like side note, I am currently on the liquid oncology unit for my medical surgical clinical shift experience. And for the first part of the semester, I was on the cardiothoracic floor, so I've been doing both of those. And I've loved those. And then this past spring, I did my nursing of women and infants clinical, which was very exciting as well because that's kind of more of what I want to do. But I love clinicals so much. I'm really excited because next semester we have like peds and psych, so those should be really cool as well. But yes, I feel like a real nurse now because of clinical. Okay, so my first tip is to pack your clinical bag the night before. I think this is super important because for me at least, there are a lot of morning clinicals which start at like 7 a.m. and you have to get to the hospital super early. And it's just easier and you feel more prepared if you pack your bag the night before. That way you don't forget anything that morning when you're like rushing and trying to get out of the house. I have a video about what kind of things to bring to clinical that I will link up here, so go ahead and make sure to watch that, and that will give you kind of a guide of what you should be packing that night before. My second tip is to get there earlier so that you can have some kind of consistency with the patient that you're seeing or the nurse that you're working with. It depends on how your program works and who your clinical instructor is. But for me, at least, when we get to the hospital in the morning, we can pick our patient from a list that the charge nurse has provided us. And I like to sometimes pick the patient that I had on Tuesday because I go Tuesdays and Thursdays. And if I pick the patient I had Tuesday, I'm usually more comfortable with them. I usually am already familiar with their diagnosis and their side effects and what's going on with them and can kind of better help them. So I think that it's important to kind of have this consistency if possible. And if it involves getting there a little bit earlier and making sure you grab that patient in particular, then definitely try to do that. My third tip is to try to give meds whenever possible. I think that like giving meds is one of my favorite things about clinical because you really like feel like a nurse for the first time. You know, you have to go to the patient's drawer, you have to take out their medications. I've been able to like administer things that I've only done in lab before, like insulin shots or IV medications. So I think it's super exciting and you can learn a lot from it as an experience in clinical. So if your instructor or whoever you're working with as a clinical asks for volunteers to do meds or asks if you're wanting to, just say yes, try to do that and do it as much as possible so you can really get this experience early on. That way, when you become a nurse someday and you're like fresh out of school or in later clinicals, you'll have that confidence and you'll be more comfortable with the skill of administering medications. My fourth tip is to don't be afraid to jump in and ask to observe or see something that's going on your floor. So I have an example. Right now I am on the liquid oncology floor, and the other day, my first day of this particular clinical experience, somebody was getting intrathecal chemotherapy administered, which goes through the spinal cavity. And I was just like, hey, do you think I could watch? I asked the nurse who was caring for that patient, and she was like, sure, yeah, no problem. So I was able to stand back and watch the procedure. And I just think that like getting these experiences and making sure you observe a lot of things is how you're gonna learn best, because there's only so much you can learn from like a lecture or a lab, and the rest of it you kind of have to learn from these hands-on in the moment experiences. So if there's something going on that you really wanna see, go ahead and ask if you could see it. Sometimes they might say no, but if they do, it's fine. There'll be more in the future. And if there's something that you want to see but don't know if it's happening, you can ask your instructor and let them know that this is something that you're interested in watching. watching. Kind of going off that is my 5th tip, which is to ask a lot of questions. I cannot stress this enough. I am so annoying with the amount of questions that I ask people on the floor, but it's really important because if you ask questions when you're not understanding something, you'll be able to put pieces together gradually, and then over time you'll just know a lot more about the nursing profession and the specialty that you're working in. I've asked my nurses that are on the floor questions about how they chose oncology, and one of the nurses I worked with was a travel nurse, so I was asking her about that. And it's just, it's good to hear different perspectives and learn a little bit about the nursing profession from people who are actually in that profession and doing it. Okay, my 6th tip is to use your CNAs on the floor as a resource. So CNAs are certified nursing assistants. I know they can be called different things depending on the hospital system you work in, but these people are going to be really helpful for you. They are doing a lot of the things that you could do as a nursing student. So taking vital signs, answering call bells, helping patients to the bathroom, everything like that. Your CNAs are going to help you if you need assistance with something and doing one of those tasks. They can definitely be a great resource. I have enjoyed going with them into patients' rooms and just observing and seeing, because a lot of the things that they do, as I mentioned, you can do as a nursing student, because the scope of things that you could do as a nursing student are kind of small, but the CNAs can help you figure out things that you could do on the floor if you're bored or not sure what you should be doing at that particular time. And that kind of segues well into my 7th tip. I think it's 7. I don't have these numbered on my list. 1, 2, 3, 4, 5, 6, 7. Yes, 7. So that segues into my 7th tip, which is to answer call bells in your downtime. If you are not in the middle of a patient assessment, or you're not giving medications, or not watching a procedure, and you hear a call bell go off, go and find out what that patient needs or what they are calling for. It's really important for patient care and just making sure as nurses we're putting the patient first. And if they need something, trying to attend to that as fast as possible so they're not kept waiting, especially if it's something that isn't kind of needed urgently. So if you're not sure what to be doing, you can always answer call bells. That's a really great way to experience more of the patient interaction that you get at clinical. I definitely recommend doing that. And I think my final tip is just to be open-minded going into a clinical. Clinical experiences are meant to show you different sides and specialties of the nursing profession. And, you might go into nursing school thinking that you want to be a certain type of nurse, but then you go into a clinical that you really, really enjoy, and it could change your mind about what kind of thing you want to do as a nurse in the future. So make sure you're just open to this, and you really just get the most out of every experience possible, even if it's not something that you thought you would want to go into. Because for me, I really wanted to do NICU nursing, and I still think I want to do that. But going into my medical surgical clinicals, I was a little bit, hesitant. I was I don't know if I'm going to enjoy this as much, because I really want to work with children and babies. But I've loved it. I've loved every second of it. So just make sure you are open-minded going into your clinical, because otherwise you won't get as much out of it. So thank you so much for watching this video. If you have any questions or anything about clinicals and the nursing school curriculum, comment them down below and I'll get back to you. You could also reach out to me on social media. All those are linked in the description box down below. But I hope you enjoyed this video, and I hope you will stick around for my future videos, which I post every weekend. Thanks for watching.